Okay. Good morning. I'm Mayor Paulette Guajardo, and today I'm joined by our city councilmen behind me, Councilman Pusley, Councilman Molina, and Councilman Martinez, and City Manager Peter Zanoni to provide an update to our residents on our COVID-19 vaccination efforts. Let us start with something I know everyone is very excited about, the City of Corpus Christi vaccine site at the American Bank Center. Your City Council and I have heard your concerns, and we're very happy to announce an Inside Corpus Christi vaccine drive. City Manager Peter Zanoni will be providing us with details regarding the American Bank vaccine drive this week in just a moment. First, I want to talk to you about our Saving Our Seniors Homebound program. The program provides vaccines to our homebound residents via our firefighters and paramedics. I want to thank Chief Rocha and our firefighters for their hard work and efforts. Currently, we are serving residents enrolled in city programs such as Meals on Wheels, and we continue to vaccinate this week, which includes 125 vaccinations today and 175 more by this Wednesday. But we understand that many homebound residents are not registered in a city program, and for that reason, we are launching a dedicated hotline that will allow homebound residents to register for this service. The hotline number is 1-888-728-0018. Now, here is something very important to understand. This hotline will not be open at all times. It will be open based on the supply for that week. So let me say that again because that is extremely important. If we do not receive a shipment one week, we will not be opening the hotline or the phone line for registration. So for example, if the city receives 300 vaccinations for the program, we will announce when the hotline is opening and only accept 300 registrations. So after the 300 registrations are filled, callers will hear an automated message letting you know that the registration slots have been filled, and we will let you know for the following week if and when it will open up and for how many. It is very important to understand, again, that the hotline will only be open when the city has the vaccine supply for the program. We anticipate this will be weekly. That is our wish. But again, we want everyone to understand that that is the only time that it's going to open, and we will stay in touch with you in regards to what that number is and when that will happen. Registrations must be based on the supply we receive that week, and that is solely based on the state's allocations to the health district. Right now, we anticipate that the phone line will be opening the week of February 8th or February 15th, and it will be open weekly again based on the supply we receive. This is a very, very fluid situation, and we will be sure to keep you informed and updated. We do anticipate receiving more vaccines in the weeks to come, as this is what we continue to hear from the federal government. But as we are beholden to them, and we hope and pray every week that we receive an allotment, and hopefully it's increased each week. But we don't know until it comes. On behalf of your City Council, we appreciate your patience and understanding during this time. We want everyone to know that providing vaccinations to our homebound residents and to seniors is your council's top priority. Now we will have a brief Spanish translation, and then City Manager Peter Zanoni will come up and tell us some details about tomorrow's vaccine drive at American Bank Center.
Le queremos dar información más reciente en cuanto al sitio de vacunación de la ciudad de Corpus Christi. Este será en el American Bank Center. Nosotros hemos escuchado sus inquietudes y nos complace anunciar una campaña de vacunación interna en Corpus Christi. El administrador de la ciudad, Peter Zanoni, nos dará esos detalles. Sobre nuestro programa Salvando a Nuestros Adultos Mayores, o SOS, este ofrece vacunas a nuestros residentes confinados en casa a través de nuestro departamento de bomberos y paramédicos. Actualmente estamos atendiendo a residentes inscritos en programas de la ciudad como Meals on Wheels. Esta semana estamos realizando algunas vacunaciones. Sabemos que no todos los residentes que están confinados en su hogar están registrados en estos programas de la ciudad, por lo que lanzamos una línea directa dedicada que permitirá a los residentes confinados al hogar registrarse para este servicio. El número de la línea directa es 1-888-728-0018. Esta línea directa no estará abierta en todo momento, solo estará abierta según la oferta de esa semana. Si no recibimos un envío en una semana, no abriremos la línea telefónica para registrarse. Por ejemplo, si la ciudad recibe 300 vacunas para el programa, anunciaremos cuándo se abrirá la línea directa y solo aceptaremos 300 registros. Una vez que se hayan completado los 300 registros, las personas que llamen escucharán un mensaje automático de que no hay más registros de vacunas disponibles. Actualmente anticipamos que la línea telefónica abrirá la semana del 8 de febrero o la semana del 15 de febrero y estará abierta semanalmente según el suministro que recibamos. En nombre de su ayuntamiento agradecemos su paciencia y comprensión durante este tiempo.
Okay, good morning, everybody. I'm Peter Zanoni, Corpus Christi's city manager. And we want to thank the council members for being here this morning, as well as the mayor, who spoke already. And after me, Nueces County Judge Barbara Canales will say some words as well. So this continues to be a joint effort between the city and the county. And today is a demonstration of that. We'll have speakers from both the city and the county this morning. We do want to thank the media for covering this as well. We did send out a notice last night, but we appreciate you being here early this morning. You know, the public is getting a lot of information, and it's important that we try to cover it accurately and as fast as we can because situations change. So we thank the media for covering it and giving the community best information they can get so they can react to things like available vaccinations. So what I want to do is just give a little context. We've been at this for about a year, right, the coronavirus pandemic, but the vaccination story is only about 30 days old. And so our first vaccine drive of a small number of 500 individuals was December 29. And we've done a total of 7 vaccine drives, all at the Richard Borchard Fairgrounds, vaccinating about 19,600 people. Right, but it was only 30 days ago that we began, and we already have tremendous success with about 20,000 persons vaccinated. Those 7 events seem like it was a long time ago, but that's all we've done is 7. We'll continue to do them as vaccines are available. And that's another important point to make note of again today, that the city and the county, we do not control vaccine allocations. We don't make the vaccine, we don't have access to the vaccine, in so much as we are beholden to the federal government to provide it to us here locally through the state government. So we're ready. We have our infrastructure in place to deliver those vaccines, but we wait on the federal government to get the vaccines. So giving you that background context of being at this for about 30 days, there's 2 important things we're notifying you of today. One is, as the mayor just said, our new hotline for online registration for the Save Our Senior program. And then the second thing is the American Bank Center drive-through vaccination mini clinic is what we're referring to them as. So that mini clinic for the first one at the American Bank Center will be tomorrow. It's going to begin at 8 o'clock, and we'll have 500 vaccines to be administered. But the key thing to know is that it's by appointment only. And so today at 1 o'clock, we'll open up registration for 500 people, and those 500 will be the ones that get vaccinated tomorrow. So the community should not camp out there tonight. They should not camp out there tomorrow. They can get there at 6:30 in the morning. We ask that those 500 that are registered get there at 6:30 tomorrow morning. There's two ways that people can register. One will be using that can we put that, there we go, using our new call number, so the 1-888-728-0018. We'll register 250 people that way. That's for seniors and others that don't have access to technology or may not know how to use the online registration. So we want them to call that number. 250 slots we'll take on that number. And then 250 persons can register online going to the city-county website, which is www.cctexas.com, coronavirus. that gets you to the city-county website, and there you want to go to vaccine registration. So we'll take 250 persons over the phone line today, beginning at 1 o'clock, and then 250 people online beginning at 1 o'clock. We know those slots are going to go quick, both over the phone and on the website, but all we have is that 500 vaccine amount today to be given tomorrow. So 500 people, we asked those people that you'll get a QR code and a unique password. Those 500 people should go to the American Bank Center at 6:30 a.m. tomorrow. They'll begin to get checked in at 6:30, and the first vaccine will take place at 8 o'clock. This is the first time we're using that venue, and so we'll see how things go. It's somewhat of a pilot, and we're going to work out some of the issues that we find out as we do the drive, and we'll make improvements in the future. The American Bank Center offers a little bit of a different drive-through experience, which is that it's by appointment only. And so we've heard loud and clear that seniors and other folks that maybe don't have stamina can't camp out all night, right? And we don't expect people to do that. So working with the county and the city, this venue, the American Bank Center, offers a little bit more customized vaccine service by appointment only. If you don't have a QR code and that password, do not show up because you'll be wasting your time, basically. And that'll continue in the future at the American Bank Center. The Orchard will continue to be a first come, first serve, and we're producing massive amounts of vaccinations there with less wait time than before when we first began about 30 days ago. I think that concludes my comments. We're going to have Nueces County Judge Barbara Canales come up as well. And yep, so Judge, why don't you come up? We're going to have this translated into Spanish, and then we'll be here to answer any questions, especially on the details, again, about the registration process for tomorrow's American Bank Center.
Queremos agradecer a la alcaldesa y a los concejales de la ciudad que se encuentran con nosotros. Este esfuerzo es por parte de la ciudad y el condado de Nueces. El público ha estado recibiendo información actual tan pronto contamos con esta. Las vacunas apenas comenzaron a llegarnos hace un mes. Hemos llevado a cabo 7 megaclínicas de vacunación y más de 19,600 personas ya han sido vacunadas. Quiero que sepa que las vacunas están controladas por el gobierno federal y no localmente. 2 cosas importantes. Primero, el número de teléfono para las personas confinadas en su hogar. Lo queremos repetir, es el 1-888-728-0018. Segundo, tendremos una clínica para 500 personas que se llevará a cabo el día de mañana en el American Bank Center, solamente para aquellas personas quienes cuenten con cita. Para hacer esa cita puede hacerlo llamando al número. 250 personas van a estar inscritas mediante ese número y 250 personas van a estar inscritas mediante el portal de internet. Le pedimos a la gente que no esté formado en línea el día de hoy, sino hasta mañana a las 6:30 de la mañana. Este es un programa piloto y queremos ver cómo va a funcionar. Le recordamos que no esté formado, ya que es solamente con cita. Las clínicas o megaclínicas en el centro Richard Borchard se van a continuar llevando a cabo periódicamente. Ahora la juez del condado, Bárbara Canales.
Thank you, Gabby. Barbara Canales, Nueces County Judge. Well, first I'm here to give thanks. Thanks first and foremost to our City County Health Department. They have just done an amazing job. We often forget that it is not us that are really out there putting shots in people's arms. It's not us donned and draped in PPE. It is not us that are waking up at 4:45 in the morning to take their positions, first getting tested and themselves to make sure they are securing the premises in their own special way, and making certain that they stay on their feet as we vaccinate thousands and thousands of people in our community. So I just want to say thank you, because today's press conference is about getting more vaccines out to our community, and that is a great thing. It's also about recognizing that under a unified command, we do things really that sometimes get unnoticed. So today, she doesn't know this, but I said, you need to cross over from the courthouse over here. With me today is Melissa Munguia, who's our emergency manager coordinator for the county. And with her leadership and her teams, along with Billy Delgado, Chief Rocha, and the city staff, they are going to do a yeoman's work tomorrow with regards to logistics, public safety, IT infrastructure, nourishment, being available for planning, and yes, writing those situation reports at the end of every clinic is absolutely necessary and required for two things. One, so we can document everything that we're doing to the state, but more importantly, so that we can get reimbursed. Part of what we are doing every day is making sure that we can keep doing it every day. And we do that when we take charge of this under this true collaborative effort. So today I give thanks to the staff from the county and from the city that will be on duty tomorrow to make certain that we expand our opportunities to see vaccines delivered to our community here in Nueces County. As the city of Corpus Christi is our largest urban center, it should be worth noting that I did some number crunching this morning, and I thought you might like to know that out of the 18,000 we've done at the fairgrounds, vaccines, that 9,844 are for citizens over the age of 65. That could be both 1A and 1B mixed in there. But make no mistake, that's an over 50% ratio, and that is really telling. In addition, on Saturday, I want to report, and I think the mayor alluded to it, but I want to report that there were over 153 senior citizens vaccinated from our health department, from vaccines that we had from, really, it's this week's allocation that we've already used last Friday. How did this come about? Well, it comes because somebody drops the ball, and we're darn good at picking it up and running with it. So there was probably two different situations where both the federal contract, for whatever reason, was not able to deliver its vaccines to this assisted living center, and we were able to answer that call. And that's what it means to be truly adaptable, to make sure that your community is taken care of in the best possible way. I want to talk a little bit, just briefly, about how we get these 500 vaccines and we allocate them to this sub-hub. They came from the allotment of week 8. That's important to know. Week 8 was an allotment of 5,000 vaccines. And with that 5,000, we were able to make an important decision together that we needed to test these logistics in town. Why? Because I predict within the next 3 weeks, we're going to have the opposite problem. We're going to have a good amount of vaccine. And when we have a good amount of vaccine, you need to be able to ready to spread it around. The goal is you've got to beat this virus at its own game. You know what this virus does better than we can do sometimes is it works fast. We've got to learn how to be faster. And that's why the Borchard Fairgrounds with this type of vaccinations, having done 18,000, is just tremendous. And how wonderful it would be to be able to follow our vaccine management plan, which we put in place months ago, to vet locations around Nueces County. So this afternoon, we'll be working towards finding a good mobile solution for our friends on the island, and that's the island that is Port Aransas. And we will also be looking for mobile solutions to come out around Nueces County as far away as Bishop and Driscoll, Agua Dulce and Banquetti. We know that if you're mobile and you can come to the fairgrounds, we're faster than anybody, quite frankly, almost in the state. And so I'd like to share with you that the plan, the strategy to bring more into the urban center is the same strategy that we have to bring more vaccines to the crossroads, where we can serve a regional healthcare priority. So last Friday night, which was just a few days ago, I wrote to Dr. Hellerstadt, who is the Commissioner of Texas State Department of Health Services, and he responded on Saturday morning. And rather than just share it with my team, I'm going to share it with all of you because I believe it to be very optimistic. I shared with Dr. Hellerstadt our ability to be swift and efficient. I shared with him our need to be even more expansive than we already are. And I asked for at least the opportunity to distribute 20,000 vaccines in our community on a 25,000 on a 5-day week and 35,000 on a 7-day week. And here is the brief response, and yet it's very telling and I believe to be optimistic. Thank you, Judge Canales. I'm sharing your request with Texas's expert vaccine allocation panel as well as the pertinent DSHS senior staff. All of us are especially encouraged that so many Texas communities have taken aggressive steps to create high-capacity vaccination capability. I also commend you on your outreach and cooperation with surrounding communities. We look forward to the coming weeks and months, hopeful in the promise that significantly higher quantities of vaccine are arriving. We want Texas residents who want the vaccine to have access to it. Signed, John. I share this with you because this is what it's going to take in order to make this sub-hub the type of hub that we have at the fairgrounds. And we all want that. We know that the urban center population is here, but we know that our mission is greater than any one location. Again, I'd like to leave you with the phrase, we're all in this together. Those are not words that we say. We have to live by them by our actions. It is about watching what people do rather than what they say. And so I will leave you with this incredible opportunity that we have together. I look forward to having both EOC teams on the ground tomorrow, testing the logistics for this hub. I would ask again for your patience as we once again prove that we are the best in South Texas at not only being nimble and flexible, but in pivoting to make sure that our seniors and those 1Bs living with chronic conditions, health conditions, will have the opportunity to get the vaccine. On a last and final note, I want to say that for the Homebound Senior Program, which is just phenomenal, that we are expanding this as well into the county areas. So just because you see CCFD, please know that we are working throughout Nueces County to get homebound seniors the vaccine. We are especially grateful in my neck of the woods to our fire marshal, as well as Jose Olivares, as well as Chief Rocha, for making this a possibility for all Nueces County residents. Thank you so much.
Quiero primero agradecer a todos los oficiales del condado, especialmente a los empleados del Distrito de Salud, quienes se levantan temprano para asistir y atender a nuestra comunidad. El día de mañana en el programa piloto evaluaremos toda la logística para poder así ofrecer más lugares y oportunidades de vacunación. Recuerde, estamos vacunando a quienes pertenecen a las fases 1A y 1B, quienes son los mayores de 65 años o mayores o quienes cuentan con una condición médica crónica y son mayores de 18 años. Las 500 vacunas fueron parte de un cargamento de 5,000 vacunas que nos llegaron del Estado. Nuestra meta es poder abatir este virus, por lo que debemos de trabajar muy rápido. Vamos a continuar trabajando para ofrecer soluciones móviles para áreas rurales como Port Aransas, Bishop y Agua Dulce. El viernes estuve en contacto con el Estado, ya que pedí poder obtener 25,000 vacunas para poder ofrecerlas en un periodo de 5 días y 35,000 vacunas para poder ofrecerlas durante un periodo de 7 días. Para poder llevar a cabo esta megaclínica debemos de tener todo preparado. También le quiero informar que estamos expandiendo el programa SOS para el resto del condado y trabajando para poderlo tener posible para todos nuestros adultos mayores.
Thank you, Judge. And just to reiterate some points, today at 1 p.m., our website will open for registration for tomorrow's vaccine drive, as well as our phone line, 1-888, is it up? Yeah, 1-888-728-0018. At 1 p.m., those two sources of registration will open and will then close after 250 people have registered online and 250 have called in. Those who do get registered, we ask that you arrive at the American Bank Center by 6:30 a.m. to be checked in, and the first vaccination will be given at 8 a.m. I also would like to clarify that this same number is the number we will be using for the Homebound Saving Our Seniors program, but not until February the 8th or the 15th. We will let you know as soon as we know that line will launch for that purpose. So we will keep you informed, but for now, this line is only for the registration of tomorrow's vaccine drive. I think that about wraps it up. So thank you. That concludes our briefing for this morning. Questions? I'm sorry. Yes.
So how many people will be monitoring that hotline, and how do you guys expect to handle the influx of people with not being as many vaccines available as there has been at the fairground?
Well, I think, do we have a number of how many? Yeah, 14. 14? Okay, so we'll have 14 operators, phone operators, that have been trained to take the calls in.
And then for the hotline and for the website, how do you guys?
We may add more. We're working on the logistics of that moving forward. And again, that might depend on how many vaccines we received for this particular program. Yes, our website. It's been approved now, pre-approved. It improved. It will not crash. We had some issues before. We've addressed them, and we are being made certain that everything will go smooth as far as the website registration goes. So that should not be a problem.
And then for people who don't get registered for this event, is there an idea of when another one like this will be?
Well, we'll continue. Every week, we will continue to inform everyone in terms of the mega site, in terms of the mini site, which is what we're calling mini drive, which is what we're calling this, and then, of course, the phone line to be registered for homebound. Yes, ma'am.
So tomorrow's drive, is it for the people the elders who register for all elders, like 65?
No, tomorrow is really it's open for anyone. We do prefer, of course, that because we're doing it by registration, that we do hope that older people who might not be able to go to a mega site vaccination drive are able to register. But the only thing, again, not until later this month, in a week or two, we'll be opening this line for the homebound program.
So for tomorrow, it's for elders, any elders, whether they're in the state program or not, and phase 1 and 2.
Right. Anyone that falls in the phase 1, the 1A and B. Yes, ma'am. Yes. Anything else? Okay. Okay, great. Thank you. Okay, I think that concludes the briefing then. Thank you.